Well, first let's explain what PGS is. This is a very misunderstood phenomenon. So many IVF centers are insisting that the patient have the embryo biopsied, take cells out, and then look at it genetically. In fact, patients almost expect that to happen now. What they don't understand is that it's in error so often, up to 40% of the time. So here, she had an embryo diagnosed as normal by PGS, and it wasn't normal. She obviously had a blighted ovum, and she wasn't going to have a baby from that so-called normal embryo. So up to 40% of the time, you can diagnose the embryo in a different direction as abnormal, and then discard it or throw it away, and it might have been a baby. And that's because the cells that are biopsied, we call the trophectoderm, are the cells that are going to become the placenta eventually in the baby. And we've all known for decades and decades that the placenta functions perfectly well with abnormal, chromosomally abnormal cells, aneuploid cells. So biopsying what's going to become the placenta is actually ridiculous. There is a little bit of a correlation with the what we call the inner cell mass or the what will become the embryo, but the error rate is so high and the damage frequently caused by embryo biopsy is so great that this is an overdone thing. I would reserve that for young women with lots of embryos that can afford to lose a few by virtue of an incorrect diagnosis or damage to the embryo from the biopsy. Or sometimes if you're confused by recurrent miscarriage, it may give you a little bit more information. But otherwise, it's really, really overdone, and it's a money spinner. It's a way for the IVF center to make $5,000 more than they would have made for a regular IVF cycle. So what I would recommend is go ahead and have your embryo transferred, see what happens, and if you don't get pregnant from that, then go through a cycle, what I recommend, of mini IVF to get the best quality embryos, and don't do this biopsy. You're being misled and fooled into thinking that somehow this is going to increase your pregnancy rate. But our studies, even published in the New England Journal of Medicine, showed that it decreases your pregnancy rate. It does not increase your pregnancy rate.